Hi, Christopher Westfall here. Thanks for joining me. Have some news about Medicare, particularly Medicare Advantage. And the reason why I keep pointing out things happening with Medicare Advantage is because for a great many people, it's detrimental. It's not the best thing possible. And yet 90% of agents currently helping seniors with their insurance needs with regard to Medicare are only talking about the free, no premium Medicare Advantage plans. But there's an alternative that they don't seem to remember. They don't bring it up because it doesn't pay us, the agent, enough money. So that's why they're only talking about Medicare Advantage, in my humble opinion. But I want you to understand there are two news stories that just came out, and I have a lot more coming up very soon. You need to stay tuned for real. But these two stories highlight what's going on in Medicare Advantage in a timely way. This is January 2024. This first one is a letter from Ron Wyden written to a lot of Medicare Advantage marketing organizations, and I'm going to have it read to you by artificial intelligence. But pay close attention to what's going on in this letter here.
To request information about Agent Pipeline's business practices related to lead generation, marketing, and enrollment in Medicare Advantage, MA, health plans. Medicare beneficiaries' health and financial future depends, in large part, on their ability to find the plan or set of plan choices that best suits their health care needs. However, a 2022 Senate Finance Committee majority staff investigation found widespread evidence of unfair tactics like fraudulent mailers, misleading TV advertisements, and unending sales calls, undermining the senior's ability to navigate and trust the Medicare plan marketplace. Earlier this year, the committee heard testimony about how the MA enrollment period is effectively open season on seniors. Seniors are being bombarded by well-intentioned brokers and bad actors who use various ploys to sell Medicare plans, such as providing misleading information about plan options and misrepresenting themselves as from the Medicare program. Witnesses confirmed the widespread sale and transfer of seniors' personal information between third-party marketing organizations and lead generators. The largely unregulated sale of seniors' information to lead generators and TPMOs has led to a race to the bottom as unscrupulous actors put their own financial interests ahead of seniors' health needs. Lead generators create lists of people who may or may not want to buy certain products by tricking seniors into responding to print, mail, television, and online advertisements. However, seniors may not understand that these ads are not from companies that sell insurance, but are actually companies in the business of collecting and then selling seniors' data to other companies indiscriminately and in bulk to other lead generators, insurance agents, TPMOs, and health insurance companies. As a result, responding to just one ad can result in seniors receiving a barrage of calls, texts, and emails from marketers and brokers who have purchased the senior's information from the lead generator that placed the ad. 5 seniors, overwhelmed by the onslaught, may then hear high-pressured sales pitches or misleading information from marketers, leading to confusion and enrollments into the Medicare Advantage plan that spent the most on marketing and lead generation, not the plan that best suits the senior's health needs. N. It has become clear that the lead generation industry remains a significant factor in the outrageous practices seniors have reported, and TPMOs are complicit in these practices through the purchase of leads. This trend is particularly problematic because taxpayers are footing the bill through Medicare Advantage plan payments. As the committee begins the next stage of its inquiry into problematic marketing practices, I am seeking information from a number of companies in your industry.
So that right there is the Senate Finance Committee trying to reach out to certain Medicare Advantage marketers who they say, based on thousands of testimonials written in and the recent hearings that we've covered in depth on this channel, people are being taken advantage of because no pun intended, because that's the only thing they're being told about. And then they get on the Medicare Advantage plan and they're denied care. And they think, and they're being told by insurance agents, everything is just the same as if you were on original Medicare, which is not true. Even agents will try to comment on my channel all the time saying, what are you talking about? Everything's exactly the same with the care that's on original Medicare as it is Medicare Advantage. Well, for those agents who are ignorant enough to not understand that there's a world of difference and you've not paid attention yet, here's the American Hospital Association and their recent podcast that just came out talking specifically about this, the difference between original Medicare and Medicare Advantage. And yes, you should pay very close attention.
Medicare Advantage, or MA plans, are another way for beneficiaries to get Medicare Part A and Part B coverage delivered through private insurance companies. MA plans adhere to the rules set by Medicare to cover beneficiaries, but their benefits are delivered by Medicare-approved private companies. MA plans are part of a broader trend towards public sources of coverage, like Medicare and Medicaid, increasingly relying on private health plans to provide or administer their health benefits. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. There are serious concerns that coverage and patient access are being eroded as a result of health insurer efforts to restrict access, and that there is a tremendous burden on healthcare providers to manage these insurer policies. In fact, the HHS Office of Inspector General recently published a report finding that MA plans have exhibited a pattern of denying prior authorization and payment requests that would have been covered by original Medicare. These types of denials have raised fears about certain insurer practices, which may impede beneficiary access to medically necessary care. Joining me to discuss how the trends around Medicare Advantage may affect patient care is Michelle Millerick, AHA Senior Associate Director of Health Insurance Coverage.
Michelle, thanks again for coming on the podcast.
Thanks for having me. Also, CMS, has the Centers for Medicare and Medicaid Services that administers the program, has been, really an advocate of sort of creating pipelines to move patients from original Medicare into managed care models, which is what Medicare Advantage is. So we see that sort of as a gateway to Medicare Advantage, where more people are sort of moving or shifting or opting for that private coverage in Medicare. Also, from our perspective, it's an increasingly lucrative market for MA plans or the private insurance companies that offer these products. We're seeing huge health plan margins in the MA space that are, for a lot of the plans, like they're making more money in this segment of the market than they are in commercial insurance. And so that's driving a lot of their behavior. You're seeing the big players in that space increasing their footprint in the market. You're seeing new health insurance companies pop up to enter the Medicare Advantage market.
But, as we were talking about a moment ago, we're implying that there is a potential downside here. What's the big problem with more people enrolled in these plans, and what are the concerns about the impact these plans are having on patients and healthcare providers?
Yeah, absolutely. So, I think MA sort of aligns with our concerns about many commercial insurance strategies in general. So, we see health plans that are using, especially with MA plans, a lot of strategies and tools to decrease their cost, but in ways that often reduce access to care for patients or add cost and burden to the healthcare system, whether it's sort of restricting or delaying sometimes access to care. And so these are things like excessive or inappropriate prior authorization or other tools that we call utilization management techniques that sometimes can cause substantial delays or negatively affect patient care. And, to be clear, these are things that when used appropriately can help to align sort of patients' care with their insurance benefits. But oftentimes in sort of the cases where we have concerns, it's places where it's inappropriate use of prior authorization or it's excessive and some of these, behaviors that affect patients negatively. Like that's what we're concerned about. And I think our members, we hear from them that this is really egregious in the MA space, which is why we're talking about it today. And just to give you a sense, there's a sort of an example from one of our members that was caring for a patient with newly diagnosed diabetes, and that patient presented with a fasting glucose blood level that was at a critically dangerous level that was about 5 times the acceptable range. And this, the clinician who was taking care of this patient learned that they could not give insulin to that patient immediately when the patient presented, which is what they were clinically indicated to do, because they had to ask that person's health insurance plan for permission to do that, and the plan said that they would take about 24 hours to do that. And so the clinician in this case had to go sort of rummage to find some insulin samples to give this patient who's presenting in a really critical situation to remedy that. And thankfully that clinician was able to do that and provide a sample while waiting for the health plan. But those are the kinds of sort of delays in care. Insulin has been widely available for more than 100 years. There's not a lot of evidence that it's overused or misused. It's not extraordinarily expensive in most cases, but these sort of plan policies that really interfere with a clinician's ability in the moment to take care of somebody who's presenting with an emergent condition that can be easily remedied.
Well, if we can stay on that point for just a sec, because I'm curious, whether a Medicare Advantage plan is accessed through a private insurer or through the government, theoretically are all playing by the same set of rules, right? So why would there be disparate impact in something like getting insulin to somebody who desperately needs it?
I'm so glad you asked that, because I think that is one of the things we think about a lot, that there should be equity or parity between people enrolled in original Medicare versus those in MA. And the MA plans do have some degree of latitude to put on prior authorization and some of these other utilization management tools that don't exist in original Medicare. So there really isn't a substantive prior authorization policy in Medicare. And it's actually one of the main sort of policy issues and concerns that we have, that sometimes these MA plans are putting out policies that are more restrictive than those that exist.
But I don't know that it needs to clarify, because it's already a rule that Medicare Advantage plans must cover the same must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
And a new rule is only as good as their being willing to change their real-world practices and CMS enforce those obligations, which it has been failing to do, correct?
In Medicare, and we see that as a huge equity issue and a huge parity issue.
Do you think that federal regulators, are aware enough of the problem to start paying some attention to it and coming up with some solutions?
Yes, absolutely. I think that's certainly part of our job in, raising that flag about some of these issues on behalf of our members and on behalf of their patients. I do think federal regulators are sort of increasingly seeing some of these problems, and I think in some of the sort of recent Medicare Advantage proposed rules, you see some additional health plan oversight provisions that are starting to come out. So I do think we're getting some traction on these issues, and, I do think that the patient voice in expressing some of these barriers and delays and confusion that these policies cause, really does make a case to regulators that some change might be needed here.
What are some of the things that MA plans could be doing to operate more efficiently and to ensure that patient access is not inhibited by administrative policies?
Yeah. So I think there's a lot of opportunity to enhance these processes to make them work better for patients. And I think a lot of those things revolve around standardizing processes and in some cases where it's appropriate, finding ways to hold health plans who have abusive practices or who are doing things that hurt patients, to hold them accountable for that behavior. On the standardization side, prior authorization that we've talked about a couple of times, every plan has their own version of that, to what services it applies to when it's needed, to the way to request a prior authorization. Do you need to call? Do you need to use a fax? Do you, need to use an electronic portal? Do you have access to that? So there's like all these different things that sort of impact, the rules for each plan, for each patient, for each service. Standardizing some of that or having some alignment, across plans or for different types of services would be helpful. And we hear from our members a lot, too, around the timeliness. I mentioned in that case with the insulin that they needed 24 hours. In some cases, especially for, maybe a patient being transferred from a acute care hospital to a post-acute care setting, we see days, go by before an answer is received about whether the health plan will sort of approve that. And so we see it as really important that there be some time frame set on that for, maybe it's a little bit longer for something that's a scheduled, foreseeable procedure, maybe 72 hours, but something that's urgent, it really should be 24 hours or less that they're getting a response. So those are a couple of the things that we're seeing. And I think the last thing I would note is that we often think about the fact that there isn't standardized reporting available about health plan appeals and grievances and information about how much prior auths how long it takes for the plan to respond, or about the denial rate, or how many, when a provider appeals or a patient appeals, how many of those are overturned in favor of the provider or the plan. And so we think public reporting on some of those measures that really are important indicators of access, but are often not known in a public or transparent way, could really help policymakers as well as others understand better what's going on underneath the hood here, and to provide a little bit more insight into where intervention might be needed.
You've been listening to a discussion.
All of these so-called competitors know they can make more money with Medicare Advantage plans. Is that right?
Yes.
If their goal is to make money, they're all going to, in effect, benefit from the products while their beneficiaries are put at a disadvantage by the prior authorization.
I'll also add that they compete for their enrollees by offering these extra benefits. And the way they are able to offer the extra benefits is by lowering the bid for Medicare covered services. So to the extent they can use prior authorization or networks, referrals, other types of utilization and cost management tools, they will be able to get a larger rebate from CMS and be able to offer more extra benefits.
It's a kind of bait and switch plan. They bait people to come in with the promise of providing more, but in fact, many of the beneficiaries receive less. Correct?
Well, I certainly wouldn't put it that way.
I would. And there's some good news with regard to all this mess in Medicare Advantage, which is, again, only regarding Medicare Advantage. And it's going to be something changing. And the Center for Medicare and Medicaid Services said they're going to have a big impact on this prior authorization nonsense. And it's going to require that the insurance companies, Medicare Advantage companies, will have to have an answer on your prior authorization request within 72 hours for expedited requests. Now, in the case we just heard about where the lady could not get her insulin and would have died had the doctor not gone around the Medicare Advantage plan, this still would not have helped that. But they also have to start telling the provider why it's being denied. Then they have to report publicly what they're denying these people for and how many times they're being denied. Oh, but guess what? Guess when this final rule announced in January of 2024 finally takes effect to start protecting you if you're on Medicare Advantage. When is that? Oh, beginning in 2026. Well, that's a whole new administration, isn't it? And there's a lot of time between now and 2026 as I'm recording this now. And so between now and then, how is this new rule, which they can tout, the administration says, we're going to protect those people on Medicare Advantage. We hear you loud and clear. And we were listening to those Senate hearings, Homeland Security and Senate Finance hearings, all about Medicare Advantage. They're finally listening to you. So what are they going to do? They're going to help you 2 years from now. Oh, but are they really? It's just bizarre how they can do this kind of thing. In Washington, D.C., only in Washington can they say we're helping you 2 years from now. But just hang in there. Don't get sick. Stay on your free plan. Everything's going to be fine. Hey, if you want to know what's happening with Medicare, and there are a lot of new updates coming in 2024, you should really subscribe to this channel. And for those who don't know, for those who've only been dealing with an agent who called you, harassed you, sent you all this junk mail, my mom just gave me today, took my mom to lunch at Bonefish, my favorite restaurant. All these Medicare mailers that were sent to her from agents who don't have referrals with people coming to them like we do. And so they send junk mail. They cold call, they knock on doors, they meet you out in the pharmacy areas to try to pitch you on one thing and one thing only, and that's Medicare Advantage. Well, it's important that you know you have two choices. Original Medicare, which is what you paid into and earned your entire working life. Original Medicare is great. The only thing about Original Medicare that's not great is, well, there are two. One, it does not pay 20% of your outpatient costs. The outpatient costs are on Part B of Medicare. Part A is wonderful. There's a big deductible, but once you pay that deductible on Part A and you go into the hospital, everything else is paid. Part B is the expensive part, and Original Medicare does not pay the Part B costs. So what do? You get a Medigap plan or Medicare supplement plan. I've been helping people with that for 26 or 27 years now. But that with Original Medicare is a complete and total package. And with a complete and total package, you can go to any doctor in the country, any hospital in the country that accepts Original Medicare, and there's no network restrictions whatsoever. There's no prior authorization like we've just been talking about, which all these experts say is the worst part of managed care is they're managing you by managing your costs. You don't have that on Original Medicare. You just have freedom to go where you need to go. And then the other thing about Original Medicare that's not good is, so many people say this and they fall for a Medicare Advantage plan solely and singly because dental. Original Medicare does not have dental. You're right, it doesn't. So what can you do for dental? You can get a dental plan that's specific for you, and actually one that pays the bills. So often people will sign up and give up Original Medicare to go into a Medicare Advantage plan because that's what you're doing. When you go on a Medicare Advantage plan, you're giving up your Original Medicare for a one contract year. And then every year those benefits change, the networks change, the hospitals can change every year, and it's different every single year. But they do that in the hopes that they'll have this comprehensive dental plan. And for 90% of the plans we've seen out there, the dental is just to say that they have dental, just to check off a box. And you can see in the comments that are thousands of comments on our channel here, people are saying, I gave up my Medicare for this, a measly benefit with a highly restrictive network that basically doesn't cover anything on dental. Yeah, you can get a dental plan, but why don't you get a real dental plan if you want it? And it's kind of like throwing your car in the trash because your windshield wiper blades need changing. The windshield wiper blades are like the dental plan. You don't give up your entire health, your entire access to everything on health just for a dental plan. You could even make a payment plan with your dentist and pay cash, and you'd be amazed at what the discounts are that you could get. But to give up original Medicare just for a dental plan that's not comprehensive in any way, shape, or form, if you really look at it. So that's original Medicare. And that's the option that you're default going to have if you just turn 65 and you sign up for Medicare. And it's pretty darn good. Original Medicare is the preferred choice. Now, the reason why a lot of people do sign up for a Medicare Advantage plan is they can't afford a Medicare supplement. And for them, they need an advocate. They need somebody to look out for them and find out, okay, if I do have to give up original Medicare because I can't pay the 20%, but I can't afford a Medicare supplement plan because it's not in my budget. I didn't save for retirement. I didn't put anything away thinking that inflation would go out of control at some point in the future. Something happened where it interrupted your work life or your saving life and you didn't save for retirement. Okay, granted. So you're going to a Medicare Advantage plan. You just want to sign up for the free, no premium plan that somebody's shoving in front of you because maybe there's an incentive there. And we've covered that many, many times what those incentives are. Their agents, literally, they're chasing those incentives with whether it's free trips or free marketing money. If you have to get a Medicare Advantage plan, you need an advocate that can work on your behalf and try to find the one that's most tailored to your needs. That is doctors that are in the network currently, and we can never promise that they'll stay there because doctors and hospital networks do change within Medicare Advantage, as we've covered many times on this channel, and they can change all the time during the middle of the year. It has nothing to do with your contract and your plan. They're not obligated to keep those doctors and hospitals all year round. So Medicare Advantage has some drawbacks, but if you do get a Medicare Advantage plan, one thing you really need to look into is cancer insurance. One of the biggest gaping holes on Medicare Advantage is their treatment for cancer. Not only the restrictions, not only the Cancer Treatment Center of America certified cancer treatment specialty hospitals that don't exist in most any Medicare Advantage plan. You just can't get the best coverage. But even if you do go to their hospital, you do go to their limited oncology networks, and you do everything that they say to do, guess what? They're still, in most all the plans, only going to pay you 80% of the cost toward that cancer treatment, chemotherapy, radiation, etc. They're only going to pay 80% of the cost. Don't believe me? Go look at your summary of benefits for your plan and see what it says for radiation therapy or chemotherapy on your cancer plan, cancer part of your plan. So what I really encourage you to do is look into cancer insurance. And we have a plan just for that. And yeah, and some agents are putting on my channel, it's really funny. They're saying that, how dare you sell Medicare Advantage plan? Well, it can't be that bad if you're selling it. Well, it's like the defense lawyer that both represents the people who are guilty and then says that the people who are not guilty still need representation too. And that's a fact. The people who, let me see if I can find this here. Where is it? Right here. The people who are on Medicare Advantage, they deserve to have good representation too. They deserve to have an honest and ethical person that will help them with their plan. So that's why we sell Medicare Advantage plans where it's appropriate. But I guarantee you one thing, we'll start with the education of what you'd be giving up. And I totally understand and I own the fact that not everyone can afford a Medicare supplement and have access to the best care in America. But we're dang sure going to make sure that you know what you'd be giving up if you sign up for the free, no-cost Medicare Advantage plan. But you need to look at the cancer insurance component. I really want you to understand that you're giving up access to some of the best cancer treatment centers in America on most Medicare Advantage plans. And even if you are able to go get the treatment that you need for cancer, you may not have an extra $25,000 or $50,000 laying around to pay somebody to come stay with you while you're going through that treatment. Even if you can't afford the 20% and you hit your max out of pocket, then a calendar year rolls around, change, and you're going to hit that max out of pocket again. Also, the other thing on Medicare Advantage is a hospital indemnity plan. And a hospital indemnity plan, and we help with those too, can cover those big bills. Some of the plans have $500 a day, $750 per day in the hospital, up to 5 or 7 days. That's a big chunk of money out of your pocket. And if you signed up for an Advantage plan thinking, everything's going to be free now, my premium's free, it's going to be a really great plan, right? Wrong. Look at the small print. Always look at your insurance contract as if it's the worst case scenario. Okay, worst case scenario, what's going to happen to me? I'm going to hit that max out of pocket. That's actually not the worst case scenario, but you'd hit that max out of pocket twice because you do it once in December and it resets again and you'd hit it possibly in January. The worst case scenario in Medicare Advantage, to be frank with you, is that they deny your care and you can't get it at all. That's just it. They just deny care. And as I've covered before, you can do a Google search for the Office of Inspector General, how that is just prolific. Talking about, let me see if I can find it really quick. Talking about how often they deny care on Medicare Advantage and the fact that 75 or 77% of the time when someone appeals it, guess what? It's overturned at some point. So you have to appeal and appeal and appeal and appeal. And when you do finally get the approval, what happens? Oh, now you've been suffering with whatever the condition has been for a very, very long time. And some people just actually can't wait that long. So if you're going to have Medicare Advantage, I would really recommend that you sock some money away. OIG. It's really good to do this at the same time. I've got the video on my site, but I just wanted to see if I could find it real quick. You can look on their website and it'll show you. Let me go up one more time. Anyway, I just want you to be aware of what the situation is if you're getting a Medicare Advantage plan. And yeah, if you need an advocate to look for a plan for you and find the best plan that's suited for you, that's what we're here for. But I just don't want you to give up original Medicare without knowing that that's the case. Oh, here it is right here. Let me just show you this one little part. This is their video, not mine.
Medicare Advantage is the managed care option within the Medicare program. It's designed to provide efficient, high-quality care that improves patient health outcomes in a cost-efficient way. But a new report by the Department of Health and Human Services, Office of Inspector General, found that sometimes Medicare Advantage plans limited access to medically necessary services. To explain this report's findings, here is 𝗲𝗲𝗍𝗲 𝗏𝗏.
In this report, we found that Medicare Advantage plans sometimes denied or delayed patients' access to care, even though the requests for services were medically necessary and met Medicare coverage rules. So in other words, the patients likely would have received approval if they had been enrolled in traditional Medicare rather than in Medicare Advantage.
These report findings are cause for concern for several reasons.
We have three main concerns about these denials for care that was medically necessary and that met Medicare coverage rules. First, these denials can cause delays or prevent patients from accessing needed health care. And that can be particularly harmful for patients who are critically ill and for whom any delay in care can cause negative health consequences. Second, these denials can cause some patients to pay out of pocket for services that are supposed to be covered by their Medicare benefits. And this can be particularly harmful for low-income patients and those who can't afford to pay for these services out of pocket. And third, these denials can cause an administrative burden for patients and providers who choose to appeal these denials. And even when denials are overturned upon appeal, we found that in some cases, going through the appeals process caused significant delays in patients' access to needed health care.
For more information, visit oig.hhs.gov/Medicare Advantage.
Prior authorization is a nightmare.
It cripples my patients, it cripples my medical practice.
It takes a lot of the joy out of medicine.
So the amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
Dealing with prior authorization is just a disaster, both for physicians, but more so for the patients. They're put in situations where they're not sure whether.
Remember, this prior authorization crap is only Medicare Advantage. And these are doctors, very highly trained specialist doctors, talking about how this is impacting their patients.
They're going to get their medication. They're not sure whether they're going to be able to have a test.
It takes time away from other patients. It frustrates physicians endlessly. I would hope that patients would recognize that doctors and patients are really on the same team, that we are as frustrated with this as they are. This is a great opportunity for patients and physicians to work together.
From the AMA standpoint, we've done a lot of different things. First thing is we pulled in health insurance plans to try and build some consensus. We also think that there are specific physicians who consistently follow evidence-based guidelines, are taking great care of their patients. Their prior auths are always getting approved. Could they maybe be gold carded? Another thing that's important to us is being able to know right there with the patient in front of us at the time that we're talking about treatment options, what things a health plan is going to cover. So we're pushing very hard for transparency.
Yeah, they did push hard. That's the American Medical Association, and all those failed. So yeah, in 2026, they're going to have new rules for Medicare Advantage plans. But until then, I think it's your right to know that you do have the choice of Original Medicare or Medicare Advantage. And if you have to have a Medicare Advantage plan, have an advocate that knows how the system works and how you can best navigate it. And if it hits the fan, you've got somebody you can call and help you possibly get out of that plan. Here's how we can help. Our website is called seniorsavingsnetwork.org. When you go there, you'll see this green button. And the green button is where you can tell us what your situation is and then get booked right on our calendar so that we can possibly help you with your situation. Especially if you're new to Medicare and the world is your oyster, you need to know what all of your options are. If you're on a Medicare plan right now and you don't know where to turn because your agent has left you in the dust because you're no longer turning 65, as most agents are just chasing that crowd, we can help you. I started my career helping people with Medicare when they were 69 to 72 years old. That was my target demographic that I created content for because they're what we call orphan clients. They've been left behind by the agents who are constantly turning 65 people. They just want people when they're aging into Medicare because it's simple. There's no underwriting. So many agents out there just don't even know how underwriting even works with a Medicare plan. So we're here to help you. You can call the number, but if you go on the website and you can book an appointment, it's a lot simpler and easier to get through. Or you can click on that QR code thing there, and that should work. Thank you so much for watching. I'm going to be keeping you up to date on what's happening with all the Medicare news because there are a lot of things coming out and you need to know what they are. Thanks for watching. God bless you. Take care. Bye-bye. Look at the video description if you want to reach out to us as well.